Now, Dr. Moore's recommendations are only that. It falls short of a mask mandate. But should it be a return to mandatory masking, not only in Ontario, but in other parts of the country, as hospitals right across Canada are dealing with this triple threat? To talk about that, we're now joined by Dr. Robert Cushman, who is currently the Acting Medical Officer of Health for Renfrew County in Ontario, and Dr. Salvo, who is a Medical Officer of Health for Alberta Health Services, responsible for the Edmonton zone. Hello to the two of you.
Good afternoon.
Dr. Hi. Dr. Cushman, I'm going to get you to start us out here, as you are in the same province as Dr. Moore. Given the strain on hospital resources right now, do you think a recommendation for mask wearing is enough?
Well, if you looked at what Dr. Moore said, he really basically said everything that would lead you to conclude we should have a mandate, but he stopped short of that. And that's because of it's essentially a political decision, and I guess he didn't get the support he needed. So, but we have enough going on at this point with these three viruses that it really it warrants a mandate. I mean, we've had so much trouble with the children. We're seeing influenza now very quickly starting to rise. COVID's actually sort of in a steady state. So as we look toward Christmas and the holiday season, and the shopping and the festivities, if we don't blunt this early, I think we're going to be in bigger trouble down the line.
Mm-hmm. Now, Dr. Salvo, Ontario is having a very different conversation than what Alberta is having right now. Can you talk to us about what you are seeing in Edmonton hospitals when it comes to RSV, as well as the flu and COVID-19?
Mm-hmm. So we're seeing an increase in activity of respiratory illnesses. Especially we could speak to influenza. We're seeing an early start to the season, so quite a few people presenting to hospital with influenza. So since late August, we had 146 hospitalization for influenza alone, with 13 ICU admissions. We're also seeing an increase in RSV cases, which affect a lot the younger children. So we're seeing quite a bit of respiratory illnesses across the board, and we really want to ask people to get vaccinated to prevent the spread of these illnesses, so we could get vaccinated against COVID and influenza to protect ourselves. We're asking them to remember that hand hygiene and all those messaging we were talking about during the pandemic to prevent respiratory illnesses, so to wash their hands with soap and water, don't touch your face. We're asking people to not share objects, so when we think of RSV, a lot of it is spreading with children who might be sharing kind of bottles, pacifiers, and toys they would put in their mouth. Wearing a mask is also another way to prevent the spread. People may choose to wear a mask even if there's no mandate, especially when they're in indoor crowded places. Earlier, Christmas shopping and all that is coming, so think about bringing your mask when you're going out. Also think about not having any ill visitors in your home, even though maybe you had plans for meeting up for Christmas or holidays. Ask people if they're ill before they come over.
Yeah, and what's interesting out of that is while Ontario right now is having this discussion about mandate versus recommendation, right now Alberta seems to be very focused on continuing the education and reminding people about the need of basic protection. Is that fair to say?
That's fair to say, and we hope people could kind of hear this message that we are experiencing strains in our emergency departments, especially our pediatric emergency department is quite full right now. So please listen to these measures and kind of do your part to help prevent the spread.
Now, Dr. Cushman, I guess part of the challenge here is it's interesting to hear Alberta's approach, because even if there were a mandate, I think the concern amongst many is how many people would actually follow that mandate. Given that people have been allowed to drop, for example, the mask, how many people would go back even if there was a mandate from the province?
Well, we've seen this before, bicycle helmets, seat belts. You can only cheerlead and recommend to a certain percentage, and then you hit a stone wall. So the real issue here is would mandates, it's a small sacrifice, what would be the repercussions for mandates? I mean, would you have civil unrest, sort of what we saw in Ottawa in January? And that's hard to gauge, I must say. So the situation does warrant a mandate, but whether it's worth the political risk, I would think that we need leadership, that we need courage, and we need the political will whereby we explain this to people and we say, look, let's do this for 3 to 4 weeks and see how we're doing. I mean, we could, as I said earlier, we could be in big trouble by, the first week of December because we didn't do this.
Quickly running out of time, but Dr. Cushman, I'm wondering if you might answer a question for me. Is there a trigger point where you think public health officials will have no choice but to bring back a mandate?
Well, I think you're already seeing it. You're seeing it in certain school boards who are considering this. You're seeing it with hospital visitation. They may do it in long-term care. The problem is in Ontario is that we have 34 health units. So you're going to see all these individual decisions, and you're going to see it's not going to be symmetrical. And that's why, health is a provincial responsibility, and that's why we look to the province for leadership and guidance when it comes to these difficult decisions.
Dr. Robert Cushman, really appreciate the time today. Thank you for that. Dr. Grace Salvo, also thank you to you for your time today.
Thank you.
Thank you.